enter the room.
Hello.
Hello.
Hello. Are you Oliver Kessler?
Yes, I am.
I'm one of the junior doctor in the surgery here. Please, can I confirm your full name and age?
Yeah, my name is Oliver Kessler and I'm 50 years old.
Oh, can I call you Oliver?
Yeah, Oliver is fine, doctor.
Okay, Oliver, I'm pleased to meet you today. How may I help you today, Oliver?
Yeah, doctor, I'm having some rash on my chest and I'm worried about that, doctor.
Okay, I'm very sorry to hear about that. I think you are worried. And I want to ask you some questions to get to the bottom of it, and then I can provide good help for you. So please, can you tell me when have you noticed this rash?
Yeah, doctor, it is quite a while now, maybe 2-3 months now.
Okay, and where exactly can you
It's,
point out?
it's on the front of my chest and
Yes,
these are in the form of small bumps, red bumps.
red bumps. Is there anything in the back of your chest as well?
No, just on the front of my chest.
Okay, okay. And since you notice them, are they growing more or decreasing?
Yeah, doctor, actually, first they're only on the chest, now they're spreading to my arms as well.
Your arm as well. Okay, okay. And which arm? Talking about
On both my arms.
both arms. Okay. Anything make it better?
No, doctor, I did not try anything.
Okay.
They just look scary. They just look scary.
Okay. Any pain?
No pain,
Any blister?
no blister.
Any fever with it?
No, doctor, no fever.
No fever. Okay. Anyone with you at home having the same condition?
No, doctor, no, it's only me.
Okay, okay. Thank you for telling me this information. Now I want to ask you about your general health. Do you have any headache,
No, doctor,
any neck pain in the neck?
no, doctor.
Okay. You told me you have no fever. There is no fever.
No fever.
Can you describe me exactly this rash you have?
Yeah, they are in the form of small red bumps on the skin and they are spreading just small in size, not very big, just small dots.
And they are not painful, as you said.
No, not painful.
Any discharge from them?
No, no discharge.
Any color, red in color?
Yeah.
Okay, any vesicle with them?
Vesicle? No, no vesicles.
Okay, no blood from them?
No blood, nothing.
Any ulcer from them?
Sorry, what?
Ulcer.
Ulcer? No, no ulcer.
Okay. Thank you very much. Now, do you have any cough or chest infection or cough?
No, I don't have any, doctor. No cough.
Do you have allergy before?
Allergy? No.
Okay. Do you have pets at home?
Pets? No, doctor.
Okay. Okay. Now I want to ask you about your health in the past. Have you been diagnosed with any medical condition?
No, no, doctor. I am fit and healthy.
Any medication you're taking or supplement?
No, I'm not taking anything.
Anyone in the family have been diagnosed with medical condition?
No, doctor.
Okay, thank you very much. Now, do you have any allergy to anything?
Allergy? No, doctor. No allergy.
Okay. Now I want to ask you: do you smoke or smoke?
No, I don't smoke.
Drinking? What about drinking?
Just socially.
Okay. Who do you live with?
I live with my wife.
Mm. Do you with your wife? Okay.
Yeah. I live with my wife.
Now, after this, I need to examine you to check your pulse, blood pressure, and I want to examine this rash, please. Can I?
Yes.
Okay. 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 Thank you for letting me examine you. After you told me this rash is red and is spreading, uh, from the examination, I think this could be uh, uh, a small hemangiomas. What do you know? What is
No, no.
Hmm?
No, doctor. Looks so scary. What is that? What you said? Sorry.
2 minutes remaining.
This called. I will explain everything. Don't worry. This is called hemangioma. Hemangioma are blood vessels that carry blood. Some small vessels in your skin carrying blood. This blood.
Okay.
This these vessels sometimes appear in the skin and show the character of the blood red like this. I think uh, I think uh, I'm going to refer you to the vascular clinic. This way they treat anything related to blood diseases, and they have many modalities of treatment. They can do laser, they uh, can do a surgery, but they are extensive. I don't think you need surgery. They can treat them with phototherapy, laser, and I think some of them are resolving spontaneously. Uh, I'm going to do and see what they are going to do. Do you have any concern or any question?
Yeah, doctor, I wanted to ask, like, why it happened to me? What caused it to develop?
It happens normally. There is no specific cause really, but some in families sometimes, and sometimes it's sporadic without any reason they can happen. And I'm going to refer you to the vascular clinics. They
But
will.
doctor, is it something dangerous?
No, it is actually not dangerous. It's not cancer. It's benign condition. So don't worry about that. From my examination, and it is a benign condition. It is not
Move on to the next station.
difficult, really.
I guess that fills in that criteria of difficulty. So good job, Dr. Nazar. So guys, what do you guys think this is? Raise your hands when you're answering. Anybody? Yeah. Yes, Dr. Go ahead.
I guess that was cherry angioma.
Yeah, cherry angioma.
All right, great. Yes, that was cherry angioma. Yes. What else do you guys know about this case?
I never know about this case. It's my first
Yes,
time. I
have
got
a
it. That means I got it right.
You got it. Dr.
Did I-
Rana is self-limiting. All right. What do you mean by self-limiting, Dr. Rana? Like, does it go away?
No, it's a benign condition, and there's nothing to worry about because it might not convert
No.
into cancer or something like that.
Yes, it's a benign condition. Dr. Beauty saying that it's no need for intervention. Yes, absolutely. There is, and what is Dr.
We need to reassurance that it's not
Needs
dangerous. Yeah.
to observe carefully. Needs to observe carefully. All right. If any change in symptom needs to review. Yes, awesome. So, Dr. Rana, you mentioned something like it's.
There's some exception
So I
about
do
it.
understand. Sorry, Dr. Ibrahim, you're saying?
Yeah, I said there's some exception about it when it's occurring at the area near the nose, the eyes, the
Yes.
genitalia, and you have to do something, and you can.
Also, if they
NHS does not cover its removal if it's for cosmetic reasons.
he said it.
Yes, absolutely.
It's like
Dr.
that.
Beauty
You can
mentioned something.
apply, is it beta blocker gels on it, something like that?
All
since
right,
I
all
have
right.
lost my
That's all.
narration.
No, actually,
Yes.
should I say something? Yeah,
Yes.
actually, this is just benign condition, just overgrowth of blood vessels. We need to reassure the patient and tell him that we should not do any intervention for that, for cosmetic reasons. This just for if anything we need to just for cosmetic reason because it's not harmful.
All right. Thank you, Dr. Dr. Beauty actually put out a very amazing point out there. She said that if it's bleeding or if there's any discharge, it needs to get looked at. So you need to give that in safety netting, definitely. But Dr. Ibrahim also brings out a good point. What if it's in the eye, right? What if it's in a very dangerous area, right? But yeah, Dr. Rana mentioned it to be hemangioma. So what do you guys know about hemangioma? You saw the age of this patient. How old was this patient?
Exactly right. Yeah, hemangioma is in premature infants, like small babies.
Yes, that's true. That is the yes, Dr. Ibrahim, you have to say, you want to say something?
No, she just read my mind. That was what I wanted to say. In children rather than in adults. Yeah.
Infants, and that is also something that self-resolves. So hemangioma is overgrowth of blood vessels. This is also something similar. This is actually dilatation of blood vessels. And Dr. Rana, to correct you, it's not self-limiting. You might actually find that it's increasing in number with time. All right, as you age, it might actually increase number. All right, so you may want to say that to the patient that you may actually keep seeing more of it. But don't worry, you need to normalize the situation, saying that it's benign and there's nothing. It wouldn't cause something dangerous unless give that intervention for safety netting, saying that if you see that it bleeds or it's having some discharge, make sure, or if you get any added symptoms along with it, make sure to come back to the clinic or seek medical help. So one thing that you can say that you will see it increase in number. That's what I want to bring out over here. With age, it's something that is related to age. So there is this huge hoax that is going on amongst people for studying for PLAB2 that it is caused amongst firefighters. Is that true, guys? Anybody?
No, I don't think so. What should be the link?
It's not just firefighters. It's just that it's risks among people in temperate areas exposed to a lot of heat. So maybe the GMC just use a firefighter, and maybe that's why they think about it like that. But I don't think it's just common
Yeah.
in firefighter.
So
Women are more
that is the main thing
in it
that I want to
compared to
highlight
men.
over here. All because there is a correlation that is not the same as causation. All because you think it's it might be exposure to heat, it may not actually mean it's actually the reason. It has no relation with heat, by the way. It has no relation with firefighters. A lot of people, I have heard this case being mentioned in such a way that it's because of firefighter fire exposure. That's why you have cherry hemangioma. I did some research on this. There is actually no evidence of that. The evidence that I do find is that if there is bromide exposure, there is a chance of it occurring. And it's related to genes. That's also very true. That is, we don't really know why this happens. So it's more related that if a family member has it, you have it as well. So family history is also very important. This person's occupation is firefighter, if you actually understand that, but do not correlate it with saying that all because he's a firefighter, it is related to that. It's not. All right. It is actually, we don't really know why this happens. There is a high correlation that this could be genetic. Otherwise, exposure to bromide has certain evidence for actually causing this condition.
I have a very good question here.
Please go ahead, Dr. Nazar.
Yes, in the case of rash, can I ask from the start, can I see the rash? Because if I see the rash, I can take a better history.
That's an interesting question, actually. So if you do see the rash,
If I see it from the first, I will know that and I will take a better history.
All right, yeah, I understand. Yeah, definitely. If that is something, if that is a format that you would like to follow, I mean, you can go ahead and do that, right? But make sure that it is structured, right? Like,
Yeah.
what are the important questions to ask around the rash? right? Do you have it anywhere else in your body? Does anybody around you have the same kind of rash?
Can
Have you
finish
come?
asking about the rash and any pain. Can I see the rash? After that, I will complete the history. It's better, I think. It's difficult to. I didn't know at the last minute. I knew this hemangioma.
I see. So most of the time, so there is a format that you usually stick to. I personally have not used this in my consultation in the PLAB too. So I will not be able to, tell you for sure. But in when they are marking you, they actually go by, marking you with a structure. So if you think by just seeing the rash, you can maintain a structure, please by all means go ahead, because and also I wouldn't know that if the simulator would give you the information immediately, but whenever you ask, anytime during the consultation, when you ask for the findings, if they have the finding, they usually do give it to you. So in the beginning itself, if you want to ask for the rash, you can try that, but try to maintain a kind of structure, like elaborate presenting complaint. Yes, somebody has something to say? Yes, Dr. Varda, go ahead.
Actually, I have taken a free session, and yes, you can ask about the, about the picture of a rash. You can say that I want to examine you at this point, but not from the start. You can say this after you have done with the danger sign. If you have done asking about the danger sign, then you can say, okay, now I would log
You mean
now I want now I would want to examine you.
what do you
Then
mean by sign?
hello.
What do you mean by the dangerous sign?
I'm sorry, I couldn't hear you.
What do you mean by the dangerous signs?
Changes sign mean, I mean, any discharge from the rash, or whatsoever the complaints in, whatsoever the danger signs in. For example, in your case, you can ask, any maybe any bleeding from it, any rash from, any, I don't know, I don't know
Yeah,
what are the
any
danger,
any discharge, any
any
bleeding, any
discharge, any bleeding.
ulceration, any those things that you asked in the history, all are danger signs.
So doctors, I'd just like to point out one thing that, when you actually, so what we are trying to do over here is we are trying to maintain a structure. So actually, Dr. Nazar's question is very valid. Like even when you are going to see this patient in the hospital, they may actually show you the rash right away. If especially it's in his hand, he may actually just show you the rash, saying that, look, I have this. So you may actually get that information beforehand, right? But the important thing that I'm trying to say is even when you do see the rash at any point, try to keep a structure in mind. You want to see the rash because it will give you a clue according to you, right? But taking a little bit history before that would also be good, right? Before you actually see what the rash is, if you can actually see take a little bit history around the rash. Does anybody have the same rash? Have you been in contact with anybody? Where is the rash? Location of the rash? Because those are the things that you're going to ask. Suppose if it's not in a place where it can't be exposed, you have to ask for the history a little bit, right? So you will be asking like, where is the rash? How many of it do you have, right? And is it there in any other part of your body? Maybe after that you can actually say, can I just take a look there so that it will give me a better idea of what it is. So to actually start saying that, you may actually get like a better idea. I think that might actually give you a better idea. But at any point, if you actually say that you want to see a certain investigation, nobody will hesitate to not give it to you. But what you need to do so that you're marked properly is to maintain a structure, elaborate the presenting complaint, rule out the associated symptoms, ask how it's affecting their livelihood, their daily life, or anything that is affecting them. Do the ICE, and then go on to do examination. Usually that is a format that you follow, but if you feel that looking at the rash would actually give you an extra edge, by all means go ahead, if that's something that you can do. But asking if you feel if it's important for your diagnosis at any point to reduce your history taking, if you want to see the rash and then come ask specific questions around that. If you feel so, please go ahead, and if you feel that's wrong, then absolutely then avoid doing that. So let's just continue with the discussion that we are having. So let's check the performance. So cherry angioma, couple of things that are known and unknown. So a couple of people do mention that it might be related to fires and firefighters have this. That's absolutely not evidence based. So what we have seen that there is relation with heat. So it's something that has relation with genetics, meaning if anybody in the family has that, or it has a relation with age. So it does increase in number with age. So do mention that as well. All right, so let's look at what all points were covered, missed, and all that. So Dr. Nasser, you actually asked a lot of good questions. And, I would say start with an open question. With every consultation, start with, you started very, like where is the rash? That's also fine. But I would want my patient to actually describe it in their words, the difficulties that they have been facing. So I would ask them for presenting complaint and ask them to explain it in their words, Like, can you tell me more about this rash? Like, how would you describe that it's, causing you some kind of impairment? What is the problem that it's causing you? So I want to hear their perspective of what the rash is. So start with an open question before you actually start with a closed one on, where it is, how many there are, what is the color, what is the consistency, border. Absolutely. Number is also a very good question. So you could have actually asked, how many are there in number, where all is it spreading? So that is one of the, reasons why this patient has come. He has been having this rash a lot in his chest, but now he's seeing that it's coming in his arms. Now he's concerned, like, why is it coming in his arms, right? So that way, you will be able to understand, all right, this is something that is actually coming in the arms as well. It's in the chest, now it's coming in the arms. So that will give you a better clinical picture here. Relevant examination, actually, I would give you marks on that. I'm sorry, I didn't mark you for this. So, but yeah, 3 marks is good enough. Yeah, one place where I would reduce marks is you're repeating a lot of your questions. There is so much time that you wasted in data gathering, and I would say that is mainly because you're repeating so many of your questions. You've gotten the answer for them, and yet you're simply asking them over and over again, and that would actually cost you marks in interpersonal skills, in data gathering, and also you get ticked in listening, because those are already questions that you know answers to, and still you're still looking for some more things. And there were some irrelevant questions that you were asking. Like you asked about, smoking history. Like how were you thinking it was relevant at all? If you think personally that a question, if you're asking a question, it would help you make the diagnosis, then go ahead and ask that question. Don't just ask that question just for the sake of asking the question because you can't remember any other question. I mean, that's what it kind of felt like. Think of it of how it's going to help you in bringing in the management. What all management would you give in this case? All right. And you mentioned vesicles. Vesicles it's not a layman term. It's something that you and I would understand. You need to ask, like, is it fluid filled? Is it pus filled? Do you think it's something is inside that? You need to ask it in a more layman terms. So if you start using technical terms in this case, again, you'll get marked for language, right? Because your entire point of asking a question is to getting across to the patient so that patient understands what you're trying to say. All right, so using technical terms will not help you in doing that at all. Right? Dr. Samar says, can someone tell me, are we practicing derm case? Yes, we are practicing the derm case. We're practicing cherry angioma, Dr. Saman. Right. Management. See, you ended up asking so many questions in history that you never really got to management at all. And there was so much that you can talk about the management, especially you mentioned that, you actually diagnosed this as hemangioma, where it's very unlikely because it's too small and it's the age of the person is not correlating. So that's why I don't think only thing that could correlate in this is because, you would be using curettage.
I talk about this management. Why not 0 mark? I talk about laser and I talk about.
But tell me, doctor, even if you did manage to diagnose this as hemangioma,
So
what were the
I
factors? What
said,
can I please finish?
yes,
So
yes.
you diagnose this as hemangioma. What are your positive findings for calling it a hemangioma? Can you actually, state what are the positive findings on why would you call it that? Like there is nothing inconsistency with the history that you called it hemangioma. So what happens when you don't know the diagnosis? There are cases which might be new and you might not know the diagnosis. Then what will you do in that situation? You need to understand that. So do not give a diagnosis all because you feel like there needs to be one, right? You're giving the treatment for, hemangioma. Don't expect to get marks for hemangioma where there is nothing there. And I can simply call it some other case because I know the case and I know the treatment and I expect to get marks for management. That doesn't make any sense.
What is the diagnosis? Cherry hemangioma. Just I forget to mention cherry. That's why.
All right, doctor. You may argue like that, but but
That
I don't think anybody else will see that point of it. All because you forgot to mention cherry, it became another diagnosis and
all
everybody else.
hemangiomas, they are small. Cherries are small hemangiomas. I'm not wrong.
All right, doctor. I think. All right, sure. Why not? So yeah, you did mention curettage. I would definitely give you that.
Laser, photo, dynamic therapy. I mentioned all of this.
Yes, absolutely. But let's try to focus on, trying to get the right diagnosis in the right words, right? We are trying to understand the case for what it is, not what we can make it,
Okay.
right? Let's try to focus
What,
along those lines. I mean, that way it would be beneficial. I know you might have said a couple of things that might, because as soon as you say hemangioma, it's an entirely different diagnosis in a lot of people's mind. Adding that cherry is very important. There's a cherry on top. And unfortunately, if you fail to say that, the whole diagnosis itself goes wrong, no matter how you argue it. You won't get a chance to argue it with anybody there,
cherry
right?
angioma at the end.
All right, sure. So let's look at what cherry angioma is. All right, these are small bright bumps on the skin caused by overgrowth of tiny blood vessels and are more common, especially with age, and tend to appear on the chest and back. These spots are harmless, non-precancerous, and unrelated to sun exposure. I think since you you went towards normalizing the situation, I think I could give you a few marks for that because it was actually, what to say, benign condition that need not have any immediate intervention planned, right? This often increases in number over the years as a normal part of aging. Treatment is usually not needed unless for cosmetic lesion or if the lesion bleeds. All right. So no treatment necessary. Say that they are harmless. If it is something that is actually bothering them, you can go in for cosmetic treatment, right? Safety netting, look out, seek further advice if the lesion changes or new symptoms seem to develop, right? Always three things you can always do for every case is safety netting, follow-up, leaflets, and pamphlets. So this patient came in without knowing his condition. So giving him a leaflet and pamphlet goes a long way in educating the patient about this condition, right? So definitely do that, provide them with how much support as much as you can, arrange a follow-up to see, if everything is fine, if the lesion is still bothering them, So, so that was the case, guys, and we had some very heated arguments and discussions today. That was pretty interesting. But so, guys, I just want to tell you a little bit about this tool that we have. So this was actually developed by Dr. Rohit and I. We have passed PLAB 2 last year, and this is one tool where we put all the cases in such a way that there are points for data gathering, management, interpersonal skills. So you can practice this with your partner. If you have a partner, you can practice it with your partner, or else we have also incorporated an AI. So if you don't have a practice partner, we have managed to incorporate an AI that can actually help you with this practice. So in every case, be it, we have around 523 cases. In every case, we have an option for practice with partner or practice with AI. And we also have a review the case where you can actually look in deeper on how this case should be done in a consultation. So practice with the AI helps you actually, practice the case, because reading the case definitely is beneficial, but getting it out in words is what the entire exam is about. So please try to practice all cases as much as you can. And a special thanks to all.
Begin.
We are giving
Enter the room.
any of the products that you like. So I'm asking the moderator to drop a 40% coupon and a link to our website. So if to use this case, to use the AI, just press on the button. So the microphone button, if you do that, you can actually start talking. Hi, my name is Dr. Anne. I'm one of the doctors in the GP clinic today. May I confirm your age and name, please?
Hello, doctor. My name is Hazel Jones, and I am 50 years old.
Thank you, Hazel. Can I understand what brings you in here today?
I found contraceptive pills in my daughter Alice's room, and I am very worried.
Yes, that is one of the cases. This is one important case that you guys, does come for the exam. So yeah, that was a little demo of our AI patient. Do check the AI. It's really helpful and very beneficial if you do practice. And if you're going to buy, please use your 40% coupon and try to purchase. You get the off. All right, guys. Would you like to continue, or should we call it a night? Anybody wants to be doctor today?
Continue, please.
All right. Do we have anybody else wanting to continue? Just raise your hand if that's something that you want. I'm so sorry, Dr. Nazar. We actually started a little early today. It's been quite a while. So if it's okay, we'll continue tomorrow. I will see you guys the same time at 4 p.m. UK time.